So we continue with this. And okay. So can you see the slide full screen?
Not full screen.
Not full screen. I'll do it one more time. Is it full screen now?
Yes.
Okay. Now we continue speaking about Socrates model. So each of the letters of this word stand for the word you should remember to ask something that you should remember to ask the patient about. So the doctor, when the doctor discusses the pain with the patient, he needs to ask several questions about the following things, like in Socrates, S stands for site, the location of pain. Onset, O, this is just the time when the pain started. Character of pain, this is C, character. So about, is the pain strong? So is the pain just acute, boring, dull? Then R stands for radiation. Does the pain radiate to any other parts of the body? Then this is association, A, associations. Then T, timing. E, exacerbating and alleviating factors. Exacerbating means exacerbating factor, these are the factors that make the pain worse, and alleviating factors, something that can make the pain less severe. And severity, so severity of pain, this is S, how strong the pain is, how bad it is, and so on. So if we have a look at this model, this letter and the words, can you think of the questions that a doctor asks about pain? For example, the first is for sight. What is the question?
Where exactly do you feel the pain?
Exactly. Okay, good. Onset.
Does it come on actually or gradually?
Okay. About character.
From a scale of 1 to 10, how bad does it hurt?
Okay. About radiation. About radiation.
Do you feel the pain anywhere else than the main location?
Good. Associations. Okay.
Do you feel the pain in any other part of the body?
Okay, so about which part of the body are involved, yes, in this process? About timing.
How long does it last for?
Okay, exacerbating and alleviating factors.
Is there anything that strongs or relieves the pain?
Great. So, and severity. Severity of pain. How bad the pain is, right? So, how severe, how strong is the pain? Actually, these are the questions here. I would like you just to take notes about this Socrates model. I mean that about the meaning of each of the letters. Actually, this information is also given in the book in Unit 1. And let us look about the questions. So if we were right about, for example, site, onset, when did it start? So was it constant, intermittent, gradual, sudden? About character, like what is the pain like, sharp, burning, tight? About radiation, so you can see associations. Is there anything else associated with the pain, for example, sweating, vomiting? So this is some other conditions that go together with the pain. So about timing, does it follow any time? How long did it last? So it's clear. You were right about exacerbating and alleviating factors. Does anything make it better or worse? And about severity, how severe is the pain? And consider using the 1 to 10 scale. So this is the just the meaning of the Socrates model. Okay, and anyway, you can find this presentation on the Moodle site, because you know that I just upload the presentations to the Moodle. Now we are going to listen to Dr. Martin and Mr. Wood. So here is the picture, and in the conversation we are going to yes, in the conversation there are some abbreviations, and before we start listening, I would like just to clear out the meaning of all the abbreviations here on this slide. So decide what the abbreviations below stand for. Abbreviations. Which of the abbreviation do you understand? Do we know what the first one means? Pulse, 100 minute. Ahmed, what does it mean?
100 beats per minute.
Okay, yes, 100 beats.
Heartbeats.
This is the pulse that the doctor just should know. And so the next line is for Zena. Are you here? Okay, no, Zena. Dilara?
BP,
Yeah. What is it?
blood pressure.
Yes, this is blood pressure. It means just 100 or 17 millimeters just of mercury, right? So the next is for Bere, number 3. Are you here, Bere? No, Bere?
Yes.
Okay, any ideas? So,
3.
yes. JV.
Jugular pressure.
Pressure, yes. Jugular venous pressure. So it is not alleviated. It shows like. Then Esginur, number 4. Can you read it, Esginur? Okay, Marwan, are you here? No, Marwan, Mohammed.
Yes, doctor.
Yes.
Sorry.
Yes, number 4.
Me or Muhammad?
So in number 4, there is abbreviation. There are letters C, V, S, NAD. Actually, NAD means no abnormality detected. And what kind of system is CVS? What kind of body system is it? S stands for system, right? So any ideas? If it is connected with heart, so what do we call this kind of system? This is cardiovascular system. Yeah. Okay, so OE stands for on examination. So the next number 6, let us listen to Mustafa, please. Number 6.
It's widespread early inspiratory fine crepitations.
Repetitions. So it's not actually the abbreviation, but this is about some sounds that a doctor can hear when he examines the body of his patient. So, and the next is Jiren, number 7. Can you read it?
Outwardly
Audible. What does it mean, audible? Something that we can hear, right? Audible. Okay, so then there is abdomen, normal. And the next line is CNS. What kind of system is CNS system? CN system.
Central nervous.
Central
Oh, sorry,
nervous
go first.
system. Yes, you're right. And the central nervous system is NAD. This is no abnormality detected. Well, and yes, this is the information about the meaning of these abbreviations. So crepitation is a peculiar cracking, crinky, or grating sound around the lungs. And let us now move to the next slide. And
Listening 3.
Start listening. We are going to listen to part of the conversation between Dr. Martin, a doctor in accident and emergency service, and Mr. Wood. As you listen, make your own notes about Mr. Wood's presenting complaint. So, A&E, accident and emergency. We're going to listen just twice, and try to remember what they're speaking about. Now I'm going to turn it on and you'll tell me if you can hear.
Listening 3.
Can you hear?
Yes, we can hear.
Okay, now.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No, I haven't brought anything up.
Okay, I'd like to ask you some questions.
Well, so this is the conversation, and
Listening 3.
now if we move to the next slide, just if you do have any just difficulties with understanding the conversation, there is the script on this slide, and now we are going to listen for the second time. You may compare what you've understood from the listening with what is given in the script, and it will help you to understand better. And if you do have some problems with the understanding of several words, you may just consult the dictionary, just look up the word in the dictionary just to clear out the meaning. Now let's listen for the second time.
Listening 3.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here. In the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No, I haven't brought anything up.
Okay. I'd like to ask you some questions.
Well, I think you understand it better now.
Listening 3.
And now let us focus on some questions. So the first question about Mr. Wood is about his job. What does Mr. Wood do? Can Mustafa answer this question?
Yes, Mr. Wood is a bus driver.
Okay, great. So, Jirian, are you here?
Yes.
Can you read and answer the next question, please?
Does Dr. Martin follow Socrates' model? Yes.
So he asks the questions that are recommended according to this model, right? Alia, read the next question, please.
Yes. What is the correct diagnosis for the shoulder pain? Can you go back?
So Mr. Wood was speaking about pain in his shoulder. And what did he do?
He's a bus driver, and he was bending over when the pain started.
And he
It's just
also,
because the audio was cutting off because my internet is bad.
I see, yes.
Yeah.
Who can comment on the shoulder pain Mr. Wood was speaking about? What did he do with his shoulder pain when he felt this pain for the first time?
He thought it was arthritis, so he put on some ointment. I don't remember the name of the ointment though.
He didn't mention, he spread some liniment, right, on the shoulder. Yes, he thought it was arthritis, but it wasn't. Okay, and the last question, Ahmed, will you read it?
What is the immediate treatment for this disease? Is it the shoulder disease or the chest?
Let us just, we have discussed the shoulder disease, but he was speaking about the pain in the chest. So what is the immediate treatment for this pain in the chest?
So I think the pain in the chest is angina pectoris or chest pain. So I would think of him using some heartburn medicine or something like that.
And the painkillers, yes?
And painkillers as well.
Yes, because the doctor started the conversation with this, just that they were going to give him some painkillers. Yes, exactly. It was like angina pectoris. So, okay. What else do you remember about Mr. Wood? So, who can add something? What else did he speak about? About the character of pain, for example? What was the pain like?
Pain is constant and tightness in the chest, like squeezing its chest. And as I said, pain is constant and dull. And it started, shoulder pain started 1 month ago, and 2 weeks ago, chest pain has started.
What was he doing at that time?
And he is struggling to catch breath. He was bending over at the garden.
In the garden.
Yes.
He was gardening.
Right. So he felt the shortness of breath there. Okay. So, and this just acute pain in the center of his chest started just about how long? When did it start? How long did it last?
2 weeks ago.
But just okay. So the
in
dull
there 1 hour.
1 hour ago, the just sharp pain. Okay, so this is the example of how doctor can follow the Socrates model to get so the detailed information about the pain, the character of pain from a patient. Now, let us focus on some grammar issues. Here, this is the language part about tenses in the presenting complaint. So you can see that when a patient describes his condition, the pain, he may use the tenses just belong to present group. And you remember that these are the 4 tenses: present simple, present continuous, present perfect, and present perfect continuous. And understanding the time patients are referring to when they speak in is crucial to making a correct diagnosis. And the question, what is the difference between these tenses? So who knows about what kind of action can we express with the help of present simple? The present simple tense? Dilara, what do you know about the present simple? Dilara, hello, where are you?
Can I answer?
What's your name?
Zainab.
Zena, please. Mhm.
The present simple tense is that when you use when you use a verb to tell about things that happens continually in the present, like every day, daily life, or every week. Like for example, I go to university every day.
Okay, exactly right. Mhm. Yes, and what about the present continuous? The present continuous tense, what kind of action does this verb describe? Mohammed?
They're actions that are going on. For example, I am doing something.
Yes, the moment of speaking. Yes, now at this moment. Okay. The present perfect tense. Mustafa. Mustafa, hello. Jiren, what do you know about the present perfect?
It's about past that happened and took some time or can be still continued.
Yes, this is the action that started in the past and it has some result in the present, right?
Yes.
Maybe
yes.
it continues, but it has some. We can see the result of this action now in the present. Okay, and the present perfect continuous. Alia, what do you remember about this tense?
Yes.
Do you remember anything?
The present. Yeah, the present perfect continuous. It shows that something started like before, and it's still continuing at this point.
Yes, and it has some result in the present, and it's important that it took just a rather long period of time. Okay.
Yes.
Well, great. I'm glad that you know something about grammar. And do you remember? I mean, and now actually this information is given here. The present simple, this tense is used to talk about something that is true at the moment of speaking. I feel better. So the patient says, for example, then something that is happening on a regular basis around now. I get these headaches in the morning regularly every morning. So you said about this, and it can also describe a process. When I lean forward, the pain goes away, or the pain starts in my chest and moves up to my shoulder. So this is also about just some things that are true at the moment of speaking. About the present continuous, this tense is used to talk about something that is happening at the moment of speaking, like his blood pressure is rising. So now, at the moment of speaking, I'm having difficulty breathing also now. The next is something that is happening around now, though not necessarily at the moment of speaking. Like example, are you taking any medication? It means this week, this month, for example, or I'm having chest pains at the moment. And something that has been arranged for a date in the near future, the future action. I'm seeing a psychotherapist next Wednesday. This is the plan for next Wednesday. And we can describe the future action with the help of the present continuous tense. And so the use of have, for example, in the present continuous to refer at the moment to the moment of speaking is more limited than in the present simple. It means sometimes we don't use have. Instead of present continuous, we use present simple. It is generally restricted to expressions such as have difficulty. We can add ing. I mean, we can use it in the present continuous. I'm having difficulty with the internet connection now, or have something to eat. It's also possible to use in the present continuous, and have a shower. In the other meanings, have shouldn't be used in the present continuous form. In continuous form, it should be used in the simple form. Well, now let's compare moment of speaking. I've got a pain in my chest, and right now I'm having pains in my chest. So the first sentence is just moment of speaking, and I'm having pains in my chest. This is like this week or for several days. And the present perfect, we use this tense to talk about a situation that begins in the past and which either continues up to the present or is related to the present in some way. It does not tell us how slowly or how quickly something has happened, only that this is the way the situation stands now. My headaches have decreased. So I mean that it started, the decreasing started in the past, and now it's better. And the present perfect continuous, we use this tense in a similar way to the present perfect, but the continuous form describes a progressive change in the situation up to now. My headaches have been decreasing slowly for some period of time. So these are just the functions of the present perfect of different present tenses. And now let us look at the next slide, and here the question, which diagram does each tense relate to? Here we can see the 4 diagrams that illustrate these simple, these present tenses, like present simple. So this is like there on the timeline. It is shown on the timeline, something that is true now at this moment. Then the second diagram is present continuous. So it started in the past and it is in progress now, and it can continue for some period of time in the future. So now it is in progress. And present perfect diagram 3 started in the past and has some result in the present period. And number 4 diagram, this is the present perfect continuous. It's also like present perfect, but the focus is also on the process. So the first sentence, we should read it and say which diagram it relates to. Ahmet, the first sentence is for you.
I've got a headache. So it's present simple.
Yes, actually, it's present simple. I have a headache, like, but formally this is like present perfect. I have got, right? So the next is for Zena, sentence B. Zena?
Yes, can you hear me?
Yes.
I've been having this shooting pain in my leg. Present continuous.
Present perfect continuous, diagram 4, right? So Dilara is not with us. Bire?
Yes.
Dilara?
Yes. Present.
C, sentence C.
Present tense, but
so sentence
present
C.
perfect.
Sentence C, I keep getting these flashing lights around my eyes and a sharp pain. Keep. Which tense is it?
Continuous.
No. This is present simple, so the basic form of the verb, present simple, right? Mhm. Okay, Bire, sentence D, read it please.
Yes, I have been having these terrible backaches.
Backaches.
Okay.
Have been having. Which tense is it?
Present continuous.
Which diagram is it?
Present perfect continuous.
Exactly, diagram number 4, present perfect continuous, as Ginur.
Yes.
E.
The pain goes right through you.
Mhm. Which tense is it?
Present continuous.
Is it continuous? Continuous has ing ending, is going. But it's like in this sentence, we can see goes. Who can help us? Which tense is it?
I don't know.
Who